Hi, today I want to talk to you a little bit about psychological or emotional trauma. What is it? It's an intense emotional response to an event or series of events that are overwhelmingly frightening, threatening, or harmful. Examples of this could be an accident, violence, abuse, natural disasters, or loss, sudden loss. It can be acute, trauma can be acute, like one single event that happened, or it could be chronic. It could be a culmination of one event after another. It could also be complex, so very prolonged over the course of your life with a lot of interpersonal trauma. And what are the signs of psychological trauma? Let's go over that. You could have intrusive memories, flashbacks, or nightmares. You could be avoiding like places and spaces that remind you of the event. There could be negative changes in mood or thinking, numbness, hopelessness, memory problems, which can present like dementia in some cases, just not remembering periods of your life. There could be hyperarousal, which is jumpiness, or easily startled, irritability, trouble sleeping, or disassociation, which is like an emotional detachment, a feeling like you're not present in your environment or your body, perhaps. There could be physical symptoms like digestive issues, stomach problems, headaches, or difficulty in functioning at work or in relationships. If these problems persist, all right, and they're causing impairment, you could receive a diagnosis of post traumatic stress disorder. That's if they persist for more than a month. It is very important to really, I always tell people just get into therapy, find an ally, a counselor, because a lot of times trauma, a lot of people are not aware of how it presents. They're not aware that they even have it. And they think that this is just life, and essentially they're in survival mode, or they're feeling stuck or frozen, or like they just can't move forward, or like past the past feels very present. If you're going through something, you feel like you're re-experiencing things, and you can't intellectualize yourself out of this. Okay. Sometimes it's in your body. Maybe you're having illnesses and there's no medical explanation to what's happening oftentimes. And that could be trauma as well, stuck in your body, stuck in your organs, stuck in your flesh, stuck in your brain. It's going to be important to get with a trauma informed therapist. Not everybody's trained to recognize what's happening with you. So you really want to connect with a trauma informed therapist, and so that they can do an assessment with you and figure out what's really going on so that you can move forward in your life and have new experiences and heal your brain. Next video, I'll talk to you about some interventions that are on the cutting edge, that you may have an opportunity to use to actually get to the root of the trauma and heal once and for all. Trauma is a tricky thing because it can present and intertwine and complicate symptoms that look like depression, symptoms that look like anxiety, and you won't know. And you don't have to suffer unnecessarily. So we'll be talking about interventions in the next video, and some of the things that you can do to help your mind, body, and soul heal from trauma. It's very subjective. So what may not be a trauma to someone else could be a trauma to another person. Don't minimize your pain. If you're having ongoing issues with emotional distress right under the surface, let's look at if you have trauma. Because once again, it's going to complicate everything else in your life. And you want to grow? Don't you want relief? All right. So thank you so much for listening. And I wish you all well, love, and peace. And I'll be following up with a video soon. Thank you. Namaste.